Hello, my name is Arnaud Fontanet. I'm a medical epidemiologist working at Institut Pasteur. I'm also professor of public health at the Conservatoire National des Arts et Métiers. And I'm going to spend a few minutes with you to review the latest epidemiological developments on the COVID-19 epidemic. What have we learned on the modes of transmission of the SARS-CoV-2 virus? At the beginning of the epidemic, we were all aware, as for other respiratory viruses, of the risk associated with those large droplets, those that you send at about 1 to 2 meters from you. And if you're facing someone who is infected from a close distance, then you're at risk of becoming infected yourself, as shown on the left side of this slide. Those droplets, large droplets, can fall on surfaces, tables, buttons, and if you touch those surfaces, you can get infected yourself. This is the reason why we recommend that you wash your hands regularly and you don't touch your nose or your mouth with your fingers. Then what we have learned is a third mode of transmission related to those very tiny droplets that we call aerosols, less than 5 microns of diameters. They can stay in suspension in the air, float in the air, and they can infect at a distance, more than this 1 or 2 meters that we were recommending initially, particularly if you are in a closed environment. And this is the reason why we say now that you should wear a mask indoor and that you should ventilate places, open your windows. This is really very important if you want to prevent transmission. Another very important area of research has been to know who are the people at risk of severe forms of disease. It appeared early that very clearly age was a major risk factor. As you can see on this table and on the figure, the older you are, the more at risk you are of dying. This is true for what we show as a case fatality ratio, the proportion of people who die among those who have symptoms, or the infection fatality ratio, which is a proportion of people dying among all those who are infected. And as you can read from the table, if you are older than 60 years of age, you are 20 times at higher risk of dying compared to someone who is younger than 60 years of age. So age clearly came out as the most significant risk factor of hospitalization and dying. Also important are the sex. Males are 2 times at higher risk of dying compared to females. And what we call comorbidities, which can be overweight or obesity, high blood pressure, diabetes, immunosuppression, renal failure, and a list which I'm not going to tell you in full, but that has been chosen to identify the people that would need protection, and particularly today vaccine, in priority. So based on what we knew from the modes of transmission, there have been a series of recommendations, what we call protective measures for short distance, that you are all aware of right now, wearing a mask, keeping the physical distance, hand hygiene, and also what we call social distancing, which relates to closure of public places where people tend to meet. And as you have understood, it is those meetings of large number of people at close distance, particularly indoors, that have been associated with the largest number of infections. And therefore, those places, particularly bars, restaurants, indoor sports areas, have been closed early when it came to control the circulation of the virus. And we have been also keen to recommend that people of older age be particularly careful because they are, as we already mentioned, more at risk of severe forms of disease. There have been numerous modeling studies in trying to find out which of all those measures were the most effective in trying to control the transmission of the virus. Unfortunately, this work is very difficult to perform. There have been some form of contradictory recommendations because in most countries, all those measures came as packages. You know, it's not like one country decided we are going to close schools and keep all the rest open, or we just close bars and restaurants, or we tell people not to meet at home. Most of the time, those measures were taken together, and it has been extremely difficult to disentangle the effect of each of those measures individually. So I'm showing you here one paper that is trying to rank those interventions by effectiveness, measured on the decrease of the basic reproductive number. You know this R number, the number of secondary cases per infected person. That has been a metric very much used to evaluate efficacy of interventions. And here you have an example where they tell you that small gatherings should be cancelled, particularly private ones at homes, but also closing of schools, closing of borders. Whether this list here is better than any of the 10 other papers which have tried to find out which of these were the most effective, I will not be able to tell you. But basically, it's a combination of those measures that we all know are effective, much more difficult to single out which one has been the most effective in preventing transmission and circulation of the virus in community. The goal to reach, the Graal here, is a herd immunity. What is this? This is a proportion of individuals in the population that should be immunized so that the virus stops to circulate in an epidemic mode. Immunized means either natural infection or vaccination. And there is a very simple formula based on the basic reproductive number of secondary cases per infected person, that tells you which proportion of the population should be immunized for the virus to stop to circulate in an epidemic mode. This formula is 1 minus 1 over R naught. If R naught, the basic reproductive number, is 3, then it's 1 minus 1 over 3. It makes 67%, what you see on this figure. And this is basically the proportion of people that should be immunized before the virus stops to circulate in an epidemic mode with the R naught that we had at the beginning of the epidemic. How to reach this herd immunity has been really a major headache for most governments. Different strategies have been proposed. One is called herd immunity, where basically you let the virus circulate in the community and you see after a time when people have been infected, the epidemic going down because you reached naturally this herd immunity. But of course you understand that comes at a huge cost, human cost, because we know that this virus is killing 7 out of 1,000 people infected. And for a country like France, it would mean 300,000 deaths. We currently are reaching 100,000, and you have seen all the suffering that goes with it. We cannot afford to let it go to reach naturally, by natural infection, these 300,000. So herd immunity is a strategy that most countries have rejected, although some of them have more or less advocated it. I would cite, for instance, Brazil or Sweden, although Sweden made it quite differently compared to this very rough way of reaching this natural herd immunity by natural infection. On the opposite side, you have the people that advocate for zero COVID. There you say, we put extremely strict measures in place, we completely stop the circulation of the virus, and when there is no longer any case on the territory, then we relax the measures and we live normally. Countries which succeeded in doing this are either very authoritarian countries like China, they made it, or countries like islands which can control their borders and really make sure that the virus doesn't come back. These are countries like Australia, New Zealand, Taiwan, and indeed they have alternated periods where they completely lock, not necessarily the entire country, but a city, for instance, when the virus has been seen, and it can be a few cases. I remember Melbourne, for instance, was completely locked for 3-4 weeks after they had detected 10 cases. But after they have controlled the resurgence of the virus and the epidemic, they can completely get back to a normal life. And when we look at the pictures coming from those countries where people have normal life, it gives us some form of nostalgia and envy. But to succeed in this, you really need to be able to control your borders. If I talk of countries like France or most of European countries, we would really need to decide this all together before it has a chance to succeed. And unfortunately, it's pretty much away from the perspectives we could have. What most countries have done is what we call stop and go. You let the virus go, you get a climbing epidemic, then saturation of your hospital services, your intensive care units, and you decide to stop. And you put in place lockdown measures. And that goes for a few weeks. You control the epidemic, it goes down, and then you relax again. And you do this stop and go. It's okay on the short term. You know, people understand that you have to put a lockdown measures when you see pictures of those intensive care units completely saturated. But on the long run, it's really exhausting for everyone to go through these different waves of we ease down, we lock, we ease down, we lock. And at the end of the day, I think it's not really the right strategy. I am part of the French Scientific Council advising the French government. And from the beginning, we have been advising for act early and hard, which means use epidemiological indicators to see if there is a starting rise in the epidemic, and then you act very early, very strong, you stop it. And if you do it this way, you will have indeed lockdowns put in place, but for shorter duration and not as intense as if you had waited for the epidemic to get out of control. Unfortunately, this approach is difficult to convey because you have to put the measures in place at a time nothing is happening. You're looking at the community, people live normally. You look at the hospitals, they are still handling well. And therefore, the population and sometimes the politics have difficulties in accepting to put in place measures when you don't see the need for it. Unfortunately, this was probably the right strategy to follow. And if I show you a description of where countries stand when it comes to excess death that you have on the x-axis and loss of GDP, gross domestic product, on the y-axis, you have countries at the top left, like South Korea, Denmark, Finland, New Zealand, Japan, where they act early and hard, or for New Zealand, for instance, they put the zero COVID in place. They have very little number of deaths, and they preserve the economy. The loss of GDP is very, very minimal. If you go to the lower right, there you have countries where, unfortunately, you have very large excess death and very large economic loss. These are the countries which did the stop and go. And at the end of the day, what this graph is telling you is that it's not economy against health, it's economy with health. If you act early and strong, you preserve both lives and your economy. But that message has been extremely difficult to convey to those who had to make the tough decisions at the right they should have made them. So now is the last chapter of this presentation around what is for the future. Well, we thought at the end of 2020 that basically we had everything in control. We knew how to apply the right measures to control the circulation of this old 2020 virus. And we had vaccines in perspective. I will come back to that. Very efficient vaccine, which came much earlier than we expected. And we thought 2021 would just be a matter of control during the first trimester, because it was still the winter and respiratory viruses like winter, and then putting in place the vaccines. And by the end of 2021, we would go back to a normal life. Unfortunately, we learned from our UK colleagues on the 10th of December that the rise in number of cases they were witnessing after the second wave was related to a new type of virus, what we call B.1.1.7, the UK variant, more transmissible due to a mutation in the 501 site, and probably also more pathogenic. And then we also learned from our colleague from South Africa and from Brazil that they also had similar type of variants with the same mutation that gives a higher transmissibility, but on the top of it, another mutation on 484, which gives an escape power to this virus that can reinfect people that were previously infected with the 2020 virus, or that can even go over immunization. People that have been immunized may not be protected as well. And this has now completely changed our perspectives. And this is what is conditioning our future in 2021 and probably the years after. We will have to fight against those variants. The herd immunity threshold, which was initially at 67%, with this more transmissible virus, we have an R naught around 4 or 5, will move up to 80%. And it means, therefore, that you will need to immunize a larger proportion of your population, and that will have to go through the vaccinations. Vaccines, that was the good news of the end of 2020. We have many which work, and it happened in just a year, something that none of us had predicted would happen. Vaccines can use mRNA, and these are the most effective ones. But they can also be based on adenovirus vectors, and they can also, like all the vaccines, use protein subunits. They have a varying efficacy ranging from 70 to 95%. What is good is that all protect against the severe forms of disease. What is still unknown is how they will protect us against the new variants. With the South African variants, they have a decreased efficacy. But fortunately, with the one of Johnson & Johnson, which was the first one to be tried in South Africa against severe forms of disease, the efficacy was retained up to 85%. We know now that the mRNA vaccine seems to work as well pretty well. This is true for the South African variant. How true is it for the variant that came from Brazil is still under consideration. And we heard recently now that in India, they have a new variant, which is also at risk of precipitating the country in a new large epidemic. So the way I can see the next month will be immunization in most countries that can afford it, that have the vaccine, hopefully reaching more than 80% of the population so that we finally get to this herd immunity threshold. Still, the virus will continue to circulate because they are not 100% effective, those vaccines. And there will be new variants, which will force us to adapt our vaccines. But the ultimate goal will be to get all countries immunized, because until the entire planet is safe, no one will be safe. Thank you very much for your attention.